Just so weird to say this because it doesn't feel like it outside. We are heading into fall, and doctors are advising you might want to start thinking about things like flu shots and COVID boosters. They may keep you from getting sick.
And even if you do still catch it, you now have more options than ever to fight off the coronavirus without needing an infusion. THV 11 Sarah Herbakowitz shows us why the COVID battleground now looks so different.
Heading into the fall, it's time to start thinking about cool season COVID spikes. But now, if your test comes back positive, you can actually get a medicine that stops the virus altogether.
We have a wide array of therapeutics that are available now compared to what we did 2 years ago.
Dr. Naveen Patil with the state health department says the accessibility to COVID medications are a game changer.
I'm hoping all these medications will prevent people from getting really sick, getting into the hospital and dying from COVID.
These drugs factoring into President Biden's announcement last week.
We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over.
But infectious disease doctors like Robert Hopkins at UAMS disagree.
And I think that's politics speak. The pandemic is still with us. We're still seeing hundreds of people die every day in this country from COVID-19.
Nearly 300 COVID patients are hospitalized right now. And while most of them will survive, this virus is still causing a strain.
We have seen over the last 3 years more COVID illnesses in the wintertime. And so I'm concerned that that may impact our health systems.
Pharmacies like Kavanaugh's in Little Rock are treating COVID cases now by not only offering, but in some cases prescribing antivirals like Paxlovid to help fight the virus.
It's most likely safe for someone for the 5-day course of therapy. We know these drugs, we've seen them, and so most people are not going to have any severe complications.
And while there might be some side effects, like commonly a metallic taste in your mouth, it can stop the virus.
And I would certainly recommend to anybody, if they test positive, to talk to their doctor or talk to their pharmacist to see if that's something that they should think about.
While the pharmacy continues to offer initial and booster vaccinations to try and get ahead of COVID.
This is our, 5th shot for some people. It's just a little bit update of the virus because the virus has mutated.
And experts remind us all to get back to basics.
Let's respect each other as fellow Arkansans and try to take care of each other through this pandemic.
Reporting in Little Rock, Sarah Herbakowitz, THV 11 News.
Kavanaugh Pharmacy also said that any parents of kids under 12 might want to wait a few weeks for the new anti-Omicron boosters to be ready in that age group.
But for those age 12 and up, you can already get this year's new booster now.